Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
How is everybody out there? Yesterday, we had promised that today we will dedicate this session for answering questions. I answer as many as I possibly could, and we will try today to answer all questions. I have recorded them all in one Word document here. If I have missed your question, send it to me again now. My WhatsApp, I don't know if it shows on the screen or not. I think it does. 694-94-0172. Please do not call, only send messages. I will not be able to take calls at this moment. So please send me your WhatsApp message of any questions that you may have in mind, and I will answer it, okay, in the order that it comes. Now, yesterday was very interesting. We had we were live 7 to 9 with Mr. Leo, and actually we got impacted with a lot of messages. So that's what we're going to start with today. Those messages that we could not answer on air yesterday. So, first question. Sir, these are my worries. I am an HIV positive on antiretroviral, that is the medication for HIV, for the last 15 years. I want to know if too much intake of these drugs is causing me weak erection. I cannot take calls, please. I want to know if too much intake of this medication, which is the ART, the antiretroviral medication, can cause me weak erection and premature ejaculation, and sometimes lack of sexual anxiety. All right, this is question number 1. Let me answer question number 1. ARTs have minimal impact on sexual desire, minimal impact on erection, and minimal impact on premature ejaculation or fast discharge. By no means I can tell you stop the ART. You cannot. So now, remember on one session I said that weak erection and premature ejaculation is a symptom of depression. Yes? That means you are mentally down. That is why you have weak erection and fast ejaculation. If you think about it, or bring all those memories back and ask yourself this one question: when is the last time I ever had a good sex? You will tell yourself, when I was very relaxed and I have not too much worries like I have today. So that means to have a good erection, you must be relaxed. You cannot have any stress, whether physical, emotional, or mental. So in order for me to have a good erection, I have to be totally relaxed. You cannot have constipation and have good erection. You may have an erection, but not a good erection. You cannot have bad malaria and fever and have a good erection. It's not possible. You cannot have a stomach pain or even if a small cut in your little finger and it pains you and you expect to have a good erection. You may have an erection, but not a good erection. So if you go back through your memory, the best erection you ever had is that one when you were fully relaxed. Not afraid of somebody to see you, not afraid of somebody of the phone that rings, and not afraid of somebody, might have doubts about your relationship. So all those factors, among the most important among which is relaxation. Good erection happens when there is relaxation and no stressors, whether the stress is physical, like a disease, even a small disease, mental or emotional, okay? So we know that is the basis of having a good erection. Normally, good erection comes with, delayed ejaculation. We're gonna stress out because most of the questions go around the same thing. So now, this 55, he said he was 55 years old, a father of 4. Then he adds to his second question, he said, I have been a heavy tea consumer every evening before going to bed, and I drink Indu, Tole, Lipton, and those are the choices of tea that I take. Well, no, the tea has nothing to do with it. As a matter of fact, the tea is a little bit of a stimulant to the central nervous system, so it has nothing to do with any of these problems. Let me remind you. So I said, good erection happen when you are relaxed, mentally relaxed, no stressors, no diseases that bothers you, and above all, a good woman that you are feeling very relaxed with, and nobody is looking over you. This is when you have a good erection, followed by delayed ejaculation, because you enjoy the sex. Now, premature ejaculation is a common problem that we see every day, but now we have to know what is the normal to understand what is the abnormal. Because I get some patients that says, listen, I ejaculate fast. So, okay, not fine. Now, what is the second concern? I, ejaculate fast and then my erection is, is weak. Then you ask them, okay, is this the first round, the first time you have sex? No, the second or third time. Obviously, you're going to be not as strong as the first time. And remember, there is a big difference between men and women. A woman is multi-orgasmic, meaning she can have multiple orgasms. Unlike men, men can have only one orgasm followed by discharge, and only once. Now, for him to get another orgasm and to go through another second round of sexual intercourse, he must have a period of time. We call it refractory period, whereby he regain back his strength and can go for another round. Obviously, the second round is not as strong erection as the first round, and that is normal. Men differs in that refractory time one to another. Some may take 10-15 minutes and he can go for the second round. Some take 2-3 hours. Some take a day. So everybody is different. Does age contribute to this? Absolutely, age contribute to this. Okay, when you are 20 is not like when you are 60. There's a big difference. Even though I'm not saying older people shouldn't have sex or cannot have sex. No, everybody from reaching adulthood all the way till the last day of his life should enjoy a good sexual life. There is no reason for you not to have a good sex life as long as you are free from anything that prevents you from having such a thing, okay? So now let's talk about the premature ejaculation, and I'll be answering a lot of questions about that because there is quite few questions that came about premature ejaculation. I just left the clinic not even an hour ago. My last patient, a very fine young man in his early 30s, and nice job, nice looking guy, fine, you know, nice body built, everything is fine. But his problem is, doc, you know, before I even penetrate, I already ejaculated. And that is destroying my relationship with my wife, or his fiancée now, is not his wife yet. That is destroying my fiancée, my relationship with my fiancée. You know, obviously I take history, so he had a child, 2.5 years old, but from another woman. And this one, he's afraid very much. I cannot take calls. Please send me a WhatsApp message. My number is 694-94-0172. 694-94-0172. Send me a WhatsApp message. I'll be more than happy to take all your messages and answer all your questions. Back to our story. So he has a woman he has a child with. Now he has another woman he's been with for the last few years. But the relationship is at risk because of the fact that she cannot enjoy sex with him, because once he ejaculates, then the sexual desire is already gone. So he cannot really, and he's afraid that this, and well, obviously this will affect your relationship with the wife or with your fiancé. So what is the solution? So we're gonna discuss what is the solution for premature ejaculation. I remember I talked about this in one of those sessions before. Today I will repeat, and I will talk slowly so you understand everything that I'm trying to convey to you. Every sexual intercourse starts with a desire. That desire is triggered by either something you've seen, something you heard, or something you touched. Those are the triggers that stimulate a sexual desire in you, in a man. What if I see a sexual stimulant, I hear a sexual stimulant, I touch a woman or the opposite sex, and I don't get the urge, which in other words, the desire to be in a sexual act? Then something is wrong. What is that something? That something is a hormone called testosterone. We are talking about men. That something is a hormone called testosterone. Normally, testosterone comes from where? From your testes. So if I measure your testes and it's less than 3.6 centimeters, that is the long axis, we put the ultrasound and we measure the testes and we see it smaller than 3.6 centimeters. That means there is some sort of hypogonadism. Hypo means less. Gonadism means the gonads that you have. So that means the testicles are small. And the reason for that has to be a disease. Something has made the testes small. Now, this disease could be you born with it. We call that congenital. There is nothing we can do about that. Like all the chromosomal abnormalities, you're supposed to be XY. If it happened to be XXY, that's a problem. If one part of the chromosome has translocated somewhere else, translocated means it changed position, that's also another problem. We're not going to bother you with the names of the syndromes that this is associated with, but I'm telling you, if you always been like this is a congenital problem. There is nothing we can do or anyone else can do. This is how it is. We cannot play around with the chromosomes, neither play around with the genetics. But this is not most of the cases that we get.